thing came in when now I had seen myself walking into the hospital a lot, and I think I just admired how maybe nurses would, some of them would treat me. Some at times I would admire how doctors would talk about your condition when you are there lying in that bed, and you're like, they know a lot. So yes, it contributes.
Hatujawasahau bana, msikuwe na stress. Okay, we will give you our opportunity to ask your questions, at least one question each person. You can ask Dr. Dongo, you can ask Milka, you can ask Cliff. Please don't ask me any question. Hii nao sitasahau kuuliza. Nauliza Milka. First of all, Milka is the most beautiful lady hapo mahali anafanya kazi. Na siwezi acha kuuliza hii swali.
Kama Blackaban TV.
Kama Blackaban TV.
Hiyo ni lazima.
Yes. Milka, are you married? Na kama hayuko married, atuambie venye hiyo condition inaenda kuinfluence kupata choosing.
I saw the question coming. I have just arrived with my answer. I am not married.
Okay.
Yes.
Hi guys, my name is Cliff. Welcome to Blackaban TV YouTube channel. Today we have a very special topic. We are going to understand sickle cell anemia. Before we start, let me introduce the crew.
Hello, my name is Julius Okoyo, Tuko Tourist Hotel. This is Blackaban TV. Kindly subscribe, like, and comment.
Hi everyone, my name is Dr. Dongo. I'm very happy to be part of today's discussion. Kindly subscribe to Blackaban TV, share and like.
Hi guys, my name is Milka Macy Akinyi. Welcome to Blackaban TV. Any comment is allowed.
Yes. This short day we're going to have two sessions. We're going to discuss one of the most misunderstood topic. We want to understand sickle cell anemia. Tuko na expert Dr. Dongo na tuko na guest pia mwenye amekuwa na hiyo condition, na pia tuko na carrier hapa hivi, tuko na Cliff ni carrier. So we want to understand this topic, and I hope this is going to be the most inspiring discussion yenye tutakuwa nayo. So wacha tuanze na Dr. Dongo to make to understand what sickle cell anemia is.
Thank you, Julius Okoyo, for the opportunity to share about sickle cell anemia. Because of the nature of our viewers, I will not use a bit of more technical scientific words. I will try to keep it as simple as possible for everyone to understand. So today's topic is sickle cell anemia, or sickle cell disease, like my colleague has put it. So sickle, maybe just to understand the terms, sickle comes from the shape. Yes, and we are going to see why this shape is very important on today's topic. When you talk of anemia, is basically, in simple terms, is reduced ability to transport the oxygen in the body. So when you talk of sickle cell anemia, we simply mean it is a genetic disorder or a disease of the blood, in simple terms. And it's a disease of the blood where you have low red blood cell count, and therefore you have the reduced capacity to transport oxygen throughout the body. Now, to our viewers, when we talk of blood, blood has a lot of components. Red blood cell is just one of them. And the function of the red blood cell is to transport oxygen throughout the body. Now, we are saying that sickle cell is a problem within the red blood cell. Red blood cell, according to how God created it, there's a shape it should have. If you look at the red blood cell, for those of us who are working in the lab and in the medical field, usually it tends to be round and it has a biconcave shape. In simple terms, it looks like a donut. But in this condition we are discussing today, that shape changes to become sickled. So when it changes the shape, there are problems that comes with that. Maybe let's understand why it changes the shape. We've said that it is a genetic disorder. So what happens to the genes? Maybe to break it down again, within the red blood cell, your red blood cell, there's something we call the hemoglobin. That is what is actually transporting blood, the oxygen within your blood. Now, it is the hemoglobin that has a problem. Which problem does it have? The hemoglobin is heme and globin. I will not talk about heme. The problem is with the globin. Now, the globin here, this one I will have to be a bit technical to understand what is the problem with the hemoglobin. The globin. Now, if you look at the structure of the globin, usually the globin has four, what we call the chains. We call them amino acid chains. Now, these amino acid chains, they vary depending whether you are a child or when before you are born, you are called an infant. Immediately you are born, you become a neonate, then an infant as time goes, as time moves, and then you become an adult. So the chain changes again when you become an adult. Now, people with the sickle cell anemia, they also have a different chain. Now, we've said we have 4 chains in the globin. When you are still within the fetus, when you are still within the uterus, you are called a fetus. Now, a fetus will have 2 alpha chains and 2 gamma chains. Now, once the fetus is born and the baby continues growing, when they become an adult, as the months move, that changes. Now, the gamma is replaced by something called beta. That is what we find in the adult hemoglobin. Yes. So what happens for you to have what we call sickle cell? Now, in the adult hemoglobin, there are problems that happens among the amino acid that forms the chain. At certain point, there is some changes that happens that would make you not having the beta chain within your globins. For those of us who are in the scientific side, you have a switch in the amino acids within the chain. At some point, you have a valine instead of glutamic acid. I will not explain into details what they are, but when you have that change within that position in the beta chains, then you end up having a different chain that is not found in the adult hemoglobin. Now, what is the implication of changing that? The implication is whatever you form, the globins that you have with that exchange, they become very sensitive to low oxygen concentration. Under low oxygen concentration, you will find that the hemoglobin within the blood vessel, within the red blood cell, they will start attaching to each other. Now, in the process of attaching to each other, they change the shape of the usual red blood cell. So it moves from the donut into the sickle. Now, once you change the shape of the red blood cells into a sickle, there are two implications that comes with it. Number one, these sickle cells will not be able to move very well within the blood vessels because they are very sticky. And when they stick to each other, they tend to block the blood vessels. And that will have the implication, and that plays a very big role in the symptoms that these patients present with. The other implication is that the sickle cells, they become very weak. So they will not last within your blood like the usual red blood cells. Under normal circumstances, the red blood cells, once they have been formed from the bone marrow, they will take about 120 days. Now, these sickle cells, their life span is very short. They take about 10 to 20 days and they are destroyed from your system. So if you keep on breaking down the sickle cells, the number of red blood cells reduce within your blood. So when they reduce, that is what we call anemia. So you have low red blood cells because you are continuously breaking down the red blood cells. Now, how do we know that somebody has sickle cell? Now, a child is born with the problem because we said it is a genetic problem. But they will not start showing the symptoms immediately they are born. It takes some time before they start showing the symptoms. Why do they take some time? Because they are born with what we call the fetal hemoglobin. Yes, because the problem will start changing. The symptoms will start manifesting when you're changing from the fetal hemoglobin to an adult hemoglobin with a problem. The adult hemoglobin with a problem is the sickle cell. So usually, of course, the maximum time when these symptoms start, the peak is around 6 months. But in some people, it will start earlier, around between the 3rd, the 4th month, and the 6th month. So which symptoms will they present with to the hospital for you to suspect that they have a sickle cell? And the symptoms they present with that come from what we have discussed. The blockage of the blood vessels because of the sickle cells that are very sticky, and of course the low amount of blood because you are breaking down the red blood cells. Now, if you block blood vessels, you might develop certain symptoms depending on where this blockage is happening. Now, most children, the most common symptoms, they will come with swollen hands, or they can also have swelling in the legs, or they will come with pain within the joints, and that is because when you block a blood vessel, you prevent oxygen supply distal to the site of blockage, the blockage. Now, reduced oxygen supply there will cause what we call ischemia. Ischemia, it means you are at a point, you are at risk of dying because you lack oxygen. Now, that is how the pain starts coming. When you are going through that process, the process of insufficient oxygen, that is how the pain comes. And of course, you have blocked the blood vessels, the drainage towards the distal to the areas is poor, and you are not supplying oxygen. You end up with inflammation, the swelling, so they will come with swollen hands, they can come with swollen legs. If the blood supply is blocked into the joints, they will have joint pains. Now, the blockage can happen in several areas. It can happen in the brain, it can happen in the kidneys, it can happen in the eyes, it can happen within the penis. So the symptoms the patient presents with will depend on where the blockage is happening. Now, we've said that their red blood cells are low, so they are anemic. When you are anemic, your immune system is very weak. Now, these children are susceptible. I've started with children. They will be susceptible to recurrent infection because of the low immunity. Already their natural immunity has not yet fully developed, but now they have another problem that is even weakening their immune system. So they will present with recurrent infection. So you treat them with infection this week. After barely a month, they come with another infection. Now that is when you will realize, you will want to find out why is this child having recurrent infections. Of course, the infection comes with the fever, so they will be going to the hospital because of fever, and they're told they have infection. And when they check their blood, you find that the blood is low. At that time, we will suspect that they have sickle cell. Now, when you have these symptoms you have talked about and you're suspecting, definitely you need to have a test. Okay. Now, in most setup where the resource constrained areas, they will do what we call a sickling test. Yes, I will not go into details how that test is done. Or they can look at the blood under a microscope and see that the blood vessels have the red blood cells have a sickle shaped. Yes, but ideally these patients, you need to do what we call HB electrophoresis, because the advantage of this, you will tell whether somebody has the disease or they are traits. Maybe I forgot about to talk about the trait and why we are saying we call some people trait and some people have the disease. We say that this is a genetic problem. And how do you inherit? We inherit through what we call autosomal recessive. Don't mind about the big term. What it simply means, when two people meet, you donate your sperm and the other one donates an egg. You contribute half-half. Yes. Now, the child will only manifest the disease if he or she has gotten donation from both the parents.
Oh, okay.
Yes, you get me? So this one contributes part of the gene, the other parent also contributes half of the gene, then the child will manifest the disease. But if the child only gets the gene from one parent, they will not manifest the disease. The child must have the genes for this from both the parents for you to have the disease. Now, how do you manage the patients? You've suspected, you've done a test, and you've made a diagnosis, the child, or whether it's most of the diagnosis is made in children. What do we do to these children? Number one, they need to be booked up to a clinic where they can be followed up. It is not like malaria where you will come, we make a diagnosis, we give you drugs, and then you take for 5 days, and then you get healed. It is a continuous process. So you have to book a clinic where you will be followed up, and the things we'll be checking as we work with you throughout the journey of management. But at least there are basic things that we need to do for these patients. We've said that their blood is always low. So they will be on something that will help them build the blood. So that is what we call folic acid. Yes, you need folic acid to generate the blood. Number two, there's another drug we call hydroxyurea. Now, what does hydroxyurea do? Hydroxyurea is known for in treatment of cancer. It's a drug meant for cancer treatment. But it has a role in people with sickle cell, because what it does, we say that when you have a fetal hemoglobin, then they are a bit resistant to the low oxygen concentration. So you want to, it is like you confuse the body. Instead of converting more of your fetal hemoglobin to adult, the hydroxyurea makes your body produce what we call fetal hemoglobin. So it makes you behave like a fetus. It makes your blood behave like a fetus, so that you can be resistant to low oxygen concentration. So that is why we give you that drug. The other drug we give you is what we call penicillin V, Pen V. Now, this penicillin is just to protect you from getting infection. We are not saying that you have an infection. but we are protecting you from infection, especially for children who are 5 years and below. And which infection do we fear? We didn't go into the whole pathophysiology of the sickle cell, but one of the things that I have to mention is one of the organs called the spleen. Now, the spleen has a very big role in cleaning up your blood. It is the one actually that helps in helping wipe out the sickle cells. The sickle cells that you are breaking down every day, it helps you wipe out. But it also has a very big role in fighting certain bacteria. Now, for patients with sickle cell, because their spleen is overworking, because of the continuous breakdown, and of course, even the blockage that we are talking about can also happen in the spleen. So the spleen can either be very big because of the overworking, and of course it can also be engorged with these sickle cells, or it can end up undergoing what we call atrophy. It can shrink and even behave like it is dead. It is not there, especially if you continuously block the blood vessels that are supplying it. So whether it is big or small, its ability to fight the bacteria is reduced. And there are certain bacteria that are very important, that very stubborn, that can only be fought well with the spleen. These are bacteria, what we say, they are encapsulated. They have certain cover, which makes them very unique. They are not easy to fight with the usual mechanisms. So there's something special within the spleen that helps us fight this bacteria. So if you have a compromised spleen, then you have to give some prophylaxis to prevent these patients from suffering from this bacteria. So we've talked of that is penicillin AV. Now, for patients who are also living in a malaria endemic region, they are given what we call malaria prophylaxis. Of course, we know malaria, it's not easy for malaria to survive in the bloodstream of a patient with sickle cell, because the malaria parasites hides within the blood vessel. Okay. Yes, but these same blood vessels are being broken down continuously from the system. So they don't commonly present with malaria, but their malaria, if they ever get it, it is very severe. Oh. Yes, because we know that the sickle cell is making you break down. You are breaking down the red blood cells because they are sickled. Malaria, again, even when you have normal red blood cells, it also breaks them down. So the anemia we are talking about is likely to even be worse. That is why they have severe malaria if they end up having it. So people living in malaria endemic region, they have to get that, what we call paludin, to prevent. Now that is the standard treatment. Additional treatment depend on how the patient presents and whatever complication they have, because of the pathophysiology. Of course, sometimes we have to transfuse the patients, but it is not a good thing to keep on transfusing them. We don't want to prevent them from requiring transfusion all the time, because that also has other complications. They might end up having iron overload. We say that sicklers already have more than enough iron. So if you keep on transfusing them, they end up having iron overload, which also has other complications that we'll not talk about. Now, it is not enough to treat. The advice you need to give parents who have children or adults who live with sickle cell. And the advice is simple. You avoid anything that will make your oxygen demand to increase. Basically that. So these children, they should avoid excessive exercise. Really excessive. You know how children play. Yeah, that excessive exercise. Yes, at least during cold seasons like this, they need to keep them warm. They need to take lots of water, because hydration also, severe dehydration increases oxygen demand in the body, and it also plays a role. So hydration, you keep warm, avoid excessive exercises, avoid climbing high altitude, because that in the high altitude you have low oxygen concentration. Yes. So I think I hope I've tried to summarize it. Yeah. There are things we could have talked about, but maybe we'll bring them up as we continue the discussion.
Okay.
Yeah.
It's a very nice one.
Huyo ni Dr. Odongo.
Okay.
Enda shule bana.
Okay. Mbona unasema ile jina yake lingine?
Husband Material 001.
Yeah.
Now, hii ni swali kwako. For the purposes ya Black Urban TV, unajua sisi tuna deal pia na mambo na relationship.
Yeah.
Now, since this topic is the least understood topic and also the most misunderstood in the society, it has a lot of misinformation. I just want to understand if you guys, let's say for example you get a child who is sickle. Do you do some counseling to parents? Kwa sababu kuna information huko nje. You said that in order for you to get a child mwenye ako na hiyo disease, lazima these people walisaidiana kupeana mtoto hiyo condition. And because I'm saying this because some guys, I know one of my best friend mwenye he got a lot of pressure from his parents that the lady mwenye alipata mtoto na yeye condition ilitoka kwao. So, but now I'm now understanding that in order for you to get, it means that you guys milisaidiana. So, is there, okay, do you guys maybe say, let's say you call the guy, you call the father of the child and the mother of the child, na muna elimisha, or what do you guys do?
Thank you, Julius, for that question. Now, I have to mention that sickle cell, the diagnosis of sickle cell comes with a lot of stigma.
Okay.
Yeah. So even at the time you suspect it, even just by telling a parent that we suspect your child has sickle cell, or we suspect, we need to rule it out. Some of them might come with resistance. They say no, usinipatie stress, sitaki kuchukua your stress. Yes, because of the implication. When you make the diagnosis, it comes with certain implications, and there's a stigma attached to it. Now, I work in hospital, and most of the time when we suspect and we actually do a test and confirm, usually it comes as a shock to the patients, because most people are carriers and they don't know.
Yes.
So you could even find that all of us here could be carriers and they don't know unless you do the test. So when we make the diagnosis, we have to explain what it means and how does somebody get it. We say it is a genetic disorder of the blood that is inherited. So inherited from you, from who? It has to come from both parents, so that we avoid quarrels at home, yes, among the couples, because there are people in the village who will say, oh, this woman is bad. I told you this woman is very bad. They will give you problems. So we do a lot of counseling.
This woman is cast.
And the counseling is not only about how the disease you get it.
Yeah.
It is because you are telling them that there is a journey that is just beginning. So you need to prepare them. First of all, explain the disease, what it means, what are the implications. This is a child who will be on drugs for almost the entire life. And of course, it comes with psychological torture. It comes with economic implications. So you have to give counseling and guidance and continue encouraging these couples. Yeah, for them to avoid problems at home, and also to ensure that we have good compliance in the treatment and following up all the instructions we give.
Okay, maybe the second question for the carriers in regards to choosing now a partner. Let's say, for example, what is your advice to the carriers, especially those, at least one of them, at least one person knows that I'm a carrier? In advice aje watu wakati wanataka choose partner. Also, for the person mwenye already ako na sickle cell disease.
Okay.
Yeah.
Now, once you have a partner and you have a baby, it is a journey that has begun. You cannot reverse. you already have a child, you're already married.
No, the question is...
I'm coming to your question.
Okay.
Yes. Now that is the first group.
Yeah.
Now the second group you are asking about is the carriers. So for my colleagues who are not married, but they are carriers.
Yes.
Now this is a genuine advice I would give. Currently, as we are speaking, of course, we know that sickle cell is malaria. If you look at the map of the world, areas that are affected with malaria, that is where the sickle cell tends to be. Now, Africa is a major place where the sickle cell is, but the awareness of the disease is very low. Actually, if you look at the countries in Africa, Nigeria is leading, and there is a campaign that is ongoing. They are encouraging everyone to know their status. Just like you can go to VCT to know your HIV status. People are encouraged to walk into the hospital and confirm your sickle cell status. Whether you are okay or you have the trait, people need to do that. So I would encourage my colleagues, before you consider settling down, you need to know your status. It will influence your decision making on which partner you want to settle down with. And there's a good reason for that. To avoid the psychological torture that comes with the situation where you can find yourself on where you cannot reverse.
And the recurrence as well.
Yes.
Okay, you've now not talked about the person when you're ready akona hiyo condition.
Yeah.
Nataka to make decision.
Yes.
To choose a partner.
Now, if you're already married,
no, you're not married. You're single.
You're single.
You have the disease.
Yeah. You have the disease.
Yes.
Okay.
But now you don't know the partner you're going to meet.
Now, if you have the trait or you have the disease, and you have to settle down, it is good to know the status of your partner before you settle down. That is the advice I would give.
What's the importance?
The importance of this, because of course there is also love,
Yes.
and other factors to be considered. Yes. Yeah, but you cannot walk into a burning house trying to prove that you are a warrior. Yeah. So to avoid the psychological torture that comes with it, and of course raising a child with sickle cell is not easy. We've said it has a lot of psychological and economic implications. Yes. So to avoid that, at least for you, you know your status. So to avoid that, I would advise you need to know the status of your partner. Because we are saying that if you have the trait and you marry a partner with a trait, then there is a chance you are going to give birth to a sickle. It is not automatic. You can end up giving birth to normal, the normal in quotes. We are not saying that sickle cell is not normal, but the normal in quotes. Or you can end up having all traits, or you can end up having all carriers. But now that there is that chance that you can give birth to abnormal hemoglobin, to a child with abnormal hemoglobin, I would advise you know your partner, so that when you even if you decide to settle down with somebody with the trait or the disease, you know the implication. You know that I'm likely to have this, and I'll deal with this when it comes.
Thank you.
Yeah.
This is Black Urban TV. We are the most organic content creators in Africa. Make sure na subscribe. Tunaenda kwa next. Tunataka sasa thank you Dr. Dongo. I know bado watu watakuuliza maswali. We're going now to move to Milka. Now, Milka, at least at what stage in your life did you now become conscious to understand that you have this disease, and how was your experience?
Okay, this is quite a big topic that most of us don't always like to talk about. But personally, I would say in life I have come to a point, it is a giant in my life I have to face. So it is a story I can easily tell.
Wow.
And it's something I can easily share so that at least I help others. So to answer your question, I think I got to know it because it was tested when I think I was a bit at an age that I would say I was conscious.
Okay.
Yes, because just as you would take a 2-year or a 3-year-old to the hospital, and in as much as every other thing would be told to the parent, to some point you will have to explain to that child that you have been tested, you have malaria, and now it will be ABC. Mine was very funny because I was 4 when I was diagnosed. Yes.
Okay.
So at 4 years it happened that I was at school, just the way you would wake up, get prepared, go to school and all that. So pains began while I was at school, and nobody understood where the pain was, because I would explain that I'm feeling joint pains, I'm feeling this pain, but it was something that was getting severe. And it so happened that my teacher that time took me to the hospital and called my parent. So upon the very many tests that were done and every other thing was normal, there was this sickling test that was done. And when the results came out, I don't know if I should say I was very conscious at that age, because I must say I'm very inquisitive.
Okay.
Yes. So when I saw my parents came in, very happy, very ready to, just tell you you'll be fine and all that. And then after that test was done, you see faces changing. Yes. So I think I remember asking my mom, why do you look sad compared to how you came in? And the answer was, no, you'll be fine. The pain will go away and all that. I was brushed away. I was not told about it. So I think I can say she opened up while I was about 6.
6 years.
Yes. That is when I think now, much as it was told to me, I would not understand how or what it's all about. But she told me there is this is you have, but now you will have to do things differently compared to others. Yes. So I would actually mark it as at 6.
At 6.
Yes.
How did it affect your family relationship?
I would say I think I received more love. Because everyone would be like, kuna baridi, vaa sweater. Everybody will be like, leo hujakunywa maji, take water. Leo, so I think I received more love compared to how it used to be. Yes.
Okay, now the next question is, how did it affect now you when you grow up now emotionally? At least ukienda mahali, people now know that you have this disease. Kuna mahali na to affect vibaya than positively, emotionally?
Yes, it has affected me positively and negatively. Positively, I would say I have gotten to understand that you can have friends who are friends and you can have friends who are not friends. Yes. There are those who will be your friends when you don't talk about it. When they know I will meet Milka and it will be stories and all fun and all. Yes. And when it gets to a point now, you have to you have to be taken maybe to the hospital, when you will have to need a helping hand. Now that is when you would understand that there are friends who are not friends, because there are people who, I should say, they fear additional tasks, or maybe let me say burden. Yes. So positively, yes, it has helped me choose my friends well and wisely. Negatively, negatively, a lot, and a lot. Yes, and majorly, I would say from my adolescent age till now. Yes. My major bad experience, major one, was at high school. Yes, it was the worst. The worst, ile, when I think somebody would ask me, you are still too young, we could just take you back to high school. I always outrightly tell people, hapo na, I can go back to first year, but see your high school. Yes, because I got the worst stigma in high school, because I would prepare like any other student and go to school. So imagine it is an opening day and you go to school, and 7 p.m. that evening, your parent has to be called back so that you go back home because you are unwell. You have pains, you have chest pains, you have every single thing that will just make you not stay at school. Yes, so other students used to see me come in, go home, come in, go home. Like I could say maybe when I was at Form 1, at Form 1, yes, I know I used to go on and off school, yes, but it was not that bad. And I think by then, people have not really known you so well. People have not even understood you so well. So the major stigma begins at Form 2, when already there are others who have come in, you know people around, and you have friends. So when you get unwell, there are people who would easily take you to the school nurse. Yes. And they would hear the school nurse ask you, ulimeza dawa? And people will be like, oh, unameza dawa? Yes. So there came a time, I just told the school nurse, you know what, yes, I will be coming with my medication to school. Obviously, it will be medication that would amount the duration you'd be at school. But I would tell the nurse, sasa sitakuwa nikikuja hapa kila siku. Because people have begun asking me questions of, hii dawa ni dawa ya nini? Mbona kila siku wewe uko kwa school nurse? Mbona? And at times, I would just brush people off that, mimi ni rafiki ya school nurse. But then they will see you get in, unapewa dawa, and they would be like, Namilka, wewe kila siku tu ni kumeza dawa, what's happening? Are you unwell or what? So I told the school nurse, Mimi, yes, I'll be coming with my medication, but then I would want you to just give me maybe for a week or a month, nikae nayo. Yes, ile, I would be the one managing and yes, and making sure that I take them at the right time and how they're supposed to be taken. So it so happened that at the time I was well, I would excel, because I would easily know that kuna duration nitaka shule. But at this time that obviously I'll be off school. So I think I used to prioritize and say, when I'm well, let me study. Because I know there will come a time that mimi mwenyewe sitajua itakuwa what time. But when it comes, at least I would have at least studied. Yes. So it comes a time when others will see you fine, wengine watakuchotea maji and all that. Yes, and when you go to the dormitory, people will be like, Milka, siku hizi huendi kwa school nurse, lakini bado kuna wakati we see you take things. So why this medication? So I think being that there were other students with other conditions, I would just tell them, niko mgonjwa tu kidogo, but it's for a duration, I'll get well. Time went by. At Form 3, now things got worse. I would not explain that I maybe know where all this began, but I began getting anonymous notes. Sio dormitory kitandani, sio class at your locker. At class would be, we are watching you. We see you take medication. Lakini we will gang up and you will have to tell us what they are. At school, at the dormitory, at the dormitory, I think I got so many anonymous notes. Like, wewe uko HIV positive, utaki kuambia watu, wewe si. So, yes, it is very traumatizing, and it is very, it brings you a lot of stigma, because it is better to get a note from somebody you know than to get a note from an anonymous person, because you would not actually know if this is one person or it is a number of people. Yes. So people began, I would say mistreating me. At times ungeambia mtu, because you'd have to feel when you are close to getting a crisis, when you are about to get those pains, you'll have to feel different. And so at times you tell someone, leo najisikia mchovu. My body is not as it is when I am okay. Nimeanza kusikia niko na some joint pains kwa miguu. Would you just help me kuchota maji? And people will be like, si ulikataa kutuambia ni nini? Hata sisi hatuchoti maji. Yes. Sometimes you'd now be in pain and you would want somebody to maybe take you to the school nurse, because at times the pains come and they grow intense very fast. When you tell someone to take you to the school nurse, mtu atakwambia pambana tu na hali yako. So it was bad to a point. Someday I got unwell, and my class prefect then never wanted to even take the information to my class teacher to call my parent. And I think the pains grew so worse to a point I couldn't get up from the bed, and I couldn't even walk on my own, just to tell maybe the school nurse that I am feeling this way and this way and this way. So it so happened that just a random cook who was just doing rounds in the dormitory ndio alikuja akaniuliza, watu wametoka wameenda class, what are you doing here? And na hiyo sauti ya you are in pain to a point even speaking is a problem. I just told her, call my parent. It was the only thing I uttered, and I just told her, call my parent. So when my parent was called, I went home and all that. So I would say the stories are very many and too long. Yes. I even remember being accused to be in a relationship with a certain teacher, because late after I had the most severe and the worst pains, I resorted to looking for maybe someone who would alternatively call my parent kama sio class teacher. Yes. So he also noticed that I was sort of silent. I wouldn't speak out a lot as I used to when I had joined. And I think we got so close to a point my parents would call and we would communicate and all that. So kama sio kuachwa kulala dormitory in pain, Kama sio kupata anonymous notes, there was being close to someone who would understand your condition. Now, being seen as you dating a teacher, yes. So, safari sio mzuri. Now there is even the worst one. When I'm not going to say where I first worked, but my first workstation, I got the very worst comments, and I think I have not even come to terms with them properly. But I think I got unwell to a point I was admitted, and it was said in the hearing of my colleague that colleague of yours huyo wa kugonjeka kila siku tunamtafutia replacement. Ndio isikue ni kugonjeka tu na sisi tunataka input. Tunamletea replacement, hata mwenye ajui kazi, she will teach once she's off from her sick bed. So yes, the replacement was brought and I had to teach. Yes. So much as maybe we would walk smiling and we would walk head high, there are very many negative things that we face and tunakanyagia tu.
Yes. Niulize swali yangu ya mwisho. This video is going to be long a bit. Tutakuwa na part A, part 2, part 3. So obviously your parents, you had the most understanding parents. Big up your parents, by the way. Na kuna watu huko nje wenye hawana parents kama wako, na pia wanapitia condition, yani wanapitia same situation. What is this one thing yenye unaweza ambia hao watu? Just something yenye unaweza ambia, something encouraging to them.
There is only this one encouragement I give every other person, be it that you have a parent or not. Those who have parents like us, they get tired. Yes. So positivity and accepting that you already have the condition is the only safe way to walk through this journey, because a parent will be, much as a parent will be there and will show you the love and will be there nursing you when you have the pains and all that, with you being very negative, or rather with you not accepting that you're already in that state, then I don't even know the word to use, but haisaidi. Yes. I remember, I think I began being positive about it once I was told by someone, your eyes are very yellow. Wewe unafaa kukaa tu mahali wagonjwa wanakaa, sio hapa. And I told myself, so people will seclude me because of my condition, then nobody will ever find out unless I'm the one who says it to them. So I think that is where I got a turning point and decided to be very positive. I didn't talk about it, but I have a follower who is also a warrior like myself. And once she saw that I would get less crisis, I used to have yellow eyes, my eyes turned to a bit ile nyeupe mtu haizi notice. She decided to follow my footsteps. So I would say positivity and accepting that you already have it is the only way out, whether you have a parent or not. That is when somebody will be very comfortable to maybe help you out. Yes.
This is a very interesting topic. So I'm going to talk as someone who has sickle cell trait, ile yenye in layman tunasema carrier, na pia I'll ask 2 questions. Tauliza Milka. So I learned about sickle cell, I think tukiwa high school, but ilikuwa ile ya juu tu kidogo. Yeah, so when I went to campus, sasa tuliingilia ndani kabisa. And everything Dr. Dongo has explained is as it is. So when I was employed, when I had a formal employment, employment that involved papers, a lot of paperwork, and it came with some benefits. I was an excited man when I first got my card, medical cover card, that now you'll be covered by your employer. Ukiwa na ugonjwa yote, ukitaka kufanya any test, if you want to treat yourself without a lot of constraints. So I had this excitement of just want to do tests. Ile test nimekuwa nikitamani kufanya, nataka kuzifanya. So I did quite a number of tests. And there's this one test that Dr. Dongo always told me. He always calls me Awiko. Awiko, if you get that card, don't forget to do HB electrophoresis. So I was yearning for that day. So when the card came, I think that was the first test I did. That was last year. I took the sample. I think it's Savin, my colleague, who drew the blood, if I'm not wrong. Then I traveled to Nairobi. And then this weekend, I'm just chilling in the house, planning on how I'll be traveling back to Homa Bay. Then I'm receiving a mail. The results are ready. So being that ever since I was young, I can't remember a single day that I've been admitted ati nimekuwa mgonjwa sana. Yeah. Kama yetu homa ama. I once had a severe malaria in 2016. But all along I've been fine. So nilijua tu hii test itakuja tu sawa. Kwani si niko tu sawa. Acha ikuje bwana. Naona tu percentage. HbA is the normal hemoglobin, the normal adult hemoglobin. HbA 64%, and the normal range should be 91 to now 98. HbS normal range should be 0%. Naona 30. Nikasema kwisha mimi. But one thing I thanked God for is that I had the knowledge. I said now I'll make sure that siku moja Mungu akinibariki na mama, itabidi ni mchambue vizuri.
Wife?
Yes. Itabidi ni mchambue vizuri, ni hakikishe ako normal ama things like that, so that nisifanye kitu yenye najua. Yes. So it hit me. It hit me kidogo tu, but I think after around 5 days I was okay. Only that now I started viewing things differently. And I was also consoling myself that kama hizi miaka zote over 25 years sijawahi kuwa na shida yoyote, sasa hii result tu ndio itanitetesha. Life must move on. But there's something that I noticed ever since nikiwa mdogo, that I used to ask myself, mbona tukifanya hata co-curricular activities shule, you could get these fellow pupils who have a lot of energy, wanaweza kimbia, wachape futa nini, But mimi nikiwa involved in tuseme strenuous activities ama kazi ngumu sana, I will get tired very fast. So nilikuwa najaribu kucorrelate being that red blood cells ziko na role na oxygen carrying, and oxygen is very important for metabolism and the daily energy. So nilikuwa najiuliza ama ndio maana mimi I am kinda weak in quotes, siwezi fanya kazi ngumu sana, but so far so good. Everything is okay. Yes.
Congratulations.
Yes. Some of my questions. So Dr. Dongo, before I ask before I ask Messi,
Yes.
is there a relationship between even being a trait and energy and exercise, something like that, from an expert point of view?
Yeah, thank you for that question. Now, generally,
Yes.
traits do not show symptoms, generally. But when subjected to the extreme conditions where either the environment is of low oxygen supply, or there is enough oxygen but your demand is extremely high, then you may show these symptoms. Yes. Even the traits, when they go to very high altitude where the oxygen saturation is low, they are likely to develop symptoms, the similar symptoms that the sicklers have. But of course, we know it will not be to the extent of the person with the sickle cell disease would have. So we will still advise that if you are a trait, we know you do not have the symptom, but do not, in as much as my colleague says he has been fine over the years, I would say you don't find yourself in those extreme conditions, because there's a chance you might develop those symptoms. Yeah.
Thank you, Doc. My question to Messi. The first question. Do you have siblings?
Yes.
Okay. My second question. Having known that you have sickle cell disease, did it influence in any way the course that you pursued? We know that you are an healthcare practitioner.
It's a question I get a lot, and I would say yes and no.
Okay.
Yes, because I had I think 2 careers in mind. I thought of being an engineer, and if it was not going to materialize, then I would end up in the medical field either way. Yes. So partly yes, I would say it has contributed to my career, because as I even chose either being on what side, the medical thing came in when now I had seen myself walking into the hospital a lot, and I think I just admired how maybe nurses some of them would treat me. Some at times I would admire how doctors would talk about your condition when you are there lying in that bed, and you're like, they know a lot. So yes, it contributes.
Hatujawasahau msikuwe na stress. We'll give you our opportunity to ask your questions, at least one question each person. You can ask Dr. Dongo, you can ask Melka, you can ask Cliff, Please don't ask me any question. Hii nao sitasahau kuuliza. Nauliza Milka. First of all, Milka is the most beautiful lady. Hapo mahali anafanya kazi. Na siwezi acha kuuliza hii swali.
Hey, kama Blackaban TV.
Kama Blackaban TV.
Hiyo ni lazima.
Yes. Milka, are you married? Na kama hayuko married, atuambie venye hiyo condition inaenda kuinfluence kupata choosing.
I saw the question coming. I have just arrived with my answer. I am not married.
Okay.
Yes. Milka is single. Has tried the love life journey, and it is the most pathetic. Yes, because the first one I would say I thought was very, very, very stable. I dated a year and 2 months, only to be told I have been told and advised by friends against having you as a partner. But all along I have not seen it. But I want to tell you that I have been sympathizing with you all this while. Yes, so that was the first and the most pathetic, and I think it made me realize that much as maybe we may want partners, but we are supposed to look for the genuinity in a person. Ni vizuri mtu akuambie yes, you are having this condition. Much as you may be beautiful and every other thing you would be told, this person should just give you a view of what he thinks or what she thinks about that relationship with you in it having that condition. Yes. After him, there were so many others. You would just tell them. In fact, after that, I think I got to this point that I would meet someone and you would familiarize with where I come from, where I work, what I do, what I love. But once you want to get some comfort, I'll just tell you, you know what? I am a warrior. I have sickle cell disease. What is your thought about it? Do you see us going anywhere? So many would tell you, I don't know about it, send me notes, I should read about, I could read so that I get acquainted and understand what it's all about. And after reading, they pack their bags and leave. Yes, and there are others who you just tell them and kutakuwa na that silence and you end up remaining there alone. So I know there's someone for me. Amen. Someone who will be someone who will be very very open and very genuine and who will tread with me this life's journey. Amen.
Sema kitu.
Kitu inakusumbua.
Yes. Having sickle cell disease or having sickle cell trait does not mean that you cannot lead a normal life. Does not mean that you cannot have a happy family. It is just a matter of, can you have that right person who can walk with you all through the journey, and someone who at least understands genetics, because it is all about genetics. Like, if I can just say in a minute, if today Milka Awaria gets a man who has hemoglobin AA, that is someone we say has normal hemoglobin, there are chances that they would have amazing children who have sickle cell trait, who are carriers. Children who, when they grow up, they can be taught about being a carrier and how they can make choices on maybe who to date and who to have happy families with. So that stigma out there, we are going to weed it out. We are saying that having sickle cell disease or having sickle cell trait like I is not a curse. And even I know that one day I will have a happy family, even if I'm a carrier. Amen.
So we're going to that direction. Tunataka muulize maswali alafu pia you can say something.
Yes.
At least usiulize tu swali, you can also say something. Okay. So what we do, we go direct to Wendy. Yes. Then after Wendy we go to Puder. Then we go to Abito. Then we go to
premarital counselor.
I'll also say something about mambo relationship
and sickle cell.
You jamani consultant. Then once you're done, tuone tunafanya hii maneno namna gani. Ndo a real consultant.
First of all, you bombarded us with a lot of knowledge. Hata nadhani zingine nitaenda kufikiria nikilala usiku. Sasa siwezi kuinternalize zote sahi.